What's your plan for your next rheumatoid arthritis flare? If you just thought, I don't have one, this video is for you. Before we dive in, grab your free RA starter kit that contains 3 critical things to do and 3 critical things to avoid after your first diagnosis of rheumatoid arthritis. Plus, we have a bonus, a free chapter of our book, The Holistic Rheumatoid Arthritis Guide. The link is below. It has helped thousands of RAers feel more in control starting today. Don't miss those gifts. Hi, I'm Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc, as well as a practicing rheumatologist here at Cary, North Carolina. Today, we will make flares less scary and more manageable with the tips we'll be talking today. In this video, you will learn what an RA flare is, the most common triggers, the mistakes that make flare last longer, and a clear flare plan so that you can feel control and you don't have to be scared with your next flare. Let me start with a story of one of our patients. Let's name her Maria. She's 42 and she's a project manager and a mom of 2. So you can imagine her plates are full. She walked into my clinic one day with more pain, more stiffness, and crushing fatigue. Her hands would not close. Morning took hours for her to prepare for her office. She was missing work. Sleep was broken, and she told me, "Doctor, I'm so scared. I'm falling apart." And she felt depressed, and she felt she's not like herself. This was a true flare that she was describing, and it was stealing her energy, her work, and her joy in life. I sat down with her and told her, "You are not falling apart. Your plan is missing. Let's build a plan together so that we can manage this flare effectively, and we can even prevent those flares in the future and manage it much better than before." Now, many of you who are new with rheumatoid arthritis, you might ask that question: what is an RA flare-up? A flare is a spike in your disease activity of rheumatoid arthritis. You feel more pain, more swelling, and more stiffness in your joints. And much more worse, you might feel more fatigue than usual. It can affect your ability to function and even participate in your work, with your family, and your daily roles. And it could be very hard for you to cope those symptoms. And these are the 3 core symptoms to watch for a flare. Number 1, stiffness, which is typically worse in the morning and the evening time. And it feels like tight band around your joints. You are not able to move your joint very well. Number 2, pain. It could be deep, throbbing, and inflammatory type of pain. And number 3, the fatigue, the heaviness, the tiredness, and you are running out of the battery. Now, let me ask you a quick question to our audience. What's your first sign you have noticed when you had a flare? Is it stiffness? Is it pain or fatigue? Please drop a comment below so that we understand more about your flare symptoms. Now, when we're thinking about managing the rheumatoid arthritis flare and understanding what the flare is, let's also understand what triggers a rheumatoid arthritis flare. Now, you might feel that the flares are random, but many of the time, if we look back, we can find those triggers. And these are the common triggers. Number 1 being stress. It could be physical or even mental stress. Moving, loss of any loved one, conflict or overdoing of chores or work can also cause you to have stress, leading to flares. Number 2, poor sleep. If you do less sleep, you have more pain the next day. Hence, sleep is very important part of managing rheumatoid arthritis flares. Number 3, dietary changes, such as more sugar, ultra-processed food, or even personal triggering food you can find out that might trigger your rheumatoid arthritis. Hence, keeping a journal of your trigger and the food is always important to understand what might be your dietary trigger. Number 4, many of you feel this way, weather or barometric changes. Some of my RA, when they come to my clinic, they could tell, oh, the weather is getting worse. There will be storm coming and there will be rain coming. And that might be one of the trigger for many of our patients. And number 5, infections. Simple cold and flu can ramp up your immune system, increasing your risk of flare. Number 6, medication changes, such as skipping your medication, sudden tapering of your medication, or sudden change with any of your medication can cause flares. Hence, I always recommend all of you to consult with your rheumatologist before making any major medication changes. Now, many of you who have watched my previous video, I always go back to my NESSCAR NESSCAR, and I call that a vehicle for managing your rheumatoid arthritis for a better future. And those NESSCAR include nutrition, exercise, sleep, stress management, checkpoints with your doctors, avoidance of risky substances, and relationship. And let me also ask you, all of you who have prior flares, which one you have used before among those NESSCAR, and let us know what worked for you. Let me also discuss one of the other important aspects in managing the flare, is including what are the common mistakes while you are managing your flares. Now, mistake number one, no plan. Now, that might be the biggest mistake. You might be surprised when you have your next flare. Just waiting and hoping can make your flare last longer. Hence, I will highly recommend you to create a written flare plan and work with your rheumatologist to make that plan so that you don't have to wait for the medication to come in, or you don't have to wait on what might be the flare plan if you have those flares. So always make your plan to avoid that first mistake of not having any plans. Number two, pushing through without pacing. On flare days, your body whispers, then it shouts. Use rest and the right pacing. Ask these important questions. What must be done today? What can wait? Where can I rest 20 to 30 minutes to help manage the flare better? Hence, pushing harder might make your flare worse. Hence, always listen to your body if you are having a flare. Mistake number three, treating pain only with pain medications. Now, you might already know flare is due to increased inflammation. The inflammation is the main villain in flare. Pain pills alone won't fix the problem. So aim to control your disease activity with anti-inflammatory medications. And always consult with your rheumatologist what could be those anti-inflammatory medications. It could be over the counter or it could be even steroid. So always consult with your rheumatologist to make a good flare treatment plan. Within this flare treatment plan, it could include topical medication such as diclofenac gel, which you can find over the counter, acetaminophen or Tylenol, which you can also find over the counter, but always consult with your doctor regarding what is the right dose for you. Gentle heat for stiffness and cold packs for hot swollen joints. And the important one, hydration and intake of enough amount of protein to manage your fatigue. Now, if your flare is quite severe, your doctor might be recommending other medications such as non-steroidal anti-inflammatory, local injection steroid into your joint, and even short course of oral steroid could be helpful. Always speak with your rheumatologist to make those treatment plans when you are having a severe flare. Now, the fourth mistake that you might be doing on your flare plan is ignoring the repeated flares. If you flare often over a course of months, your baseline therapy of RA medication may need to be adjusted or upgraded. Don't wait. Speak with your rheumatologist if you have recurrent flares. That's a warning sign that your disease is still very active. Modifying the treatment, including DMARD or disease-modifying anti-rheumatic drugs, might be the best way to minimize your future flare. Now, the mistake number 5, missing the red flags. Please call your rheumatologist if you have very severe flare, if you have flare in multiple joints, you have fever, skin rashes, you are having shortness of breath, or any other new unusual symptoms. Always consult with your rheumatologist. It may not be a true flare. It might be a symptom of other medical conditions such as infection. Hence, if you have any of those symptoms, always consult with your rheumatologist. It's always good to check with them early rather than later when it might be getting worse soon. So please consult with your rheumatologist if you have any of those severe symptoms. Now, let me move you back to Maria's story. When she first came to me with a flare, we sat down on the clinic visit. We wrote a one-page flare plan. We created a good systemic plan that included on day 1 and day 2 at home, she could use topical diclofenac, acetaminophen or Tylenol as safe as possible, gentle heat in the morning and short cool patch in the evening, then 10 minutes of joint-friendly walk or stretching exercises every day before bedtime. And we also discussed about creating a communication channel. If the pain and swelling spread to multiple joints or last for more than 2 to 3 days, she will be calling the clinic to get more help. Then we also look at the other options, including considering steroid if in case the flare is more difficult to manage, or if it is lasting for too long period of time. And we also talk about our NESSCAR micro habits that included focusing on nutrition, swapping her dessert with a berry or yogurt, decreasing the salt intake, and increasing the hydration. Exercise. We discuss about 5 to 10 minutes of gentle exercises such as range of motion twice a day. We talk about the importance of sleep habits, and we talk about stress management, at least having some breathing exercises in between her work. We also talk about checkpoints, tracking her flare symptoms, our sleep hours, and the triggers for those flares. We also discuss about avoiding the risky substances that could cause flare, such as excessive alcohol and no smoking. We also discuss the importance of creating a good relationship with herself and speaking with her husband. We also make a plan in case of flare. She will ask her husband to make dinner and help her children so that she doesn't need to overexert herself to manage the flares. Now, all of you RA warriors, let me pause and remind you of our free downloads. Our download of 3 important things you should do and 3 things you should avoid with your initial diagnosis of rheumatoid arthritis. And plus, we also have an extra bonus for you. That is a free copy of one of the chapters of our book that includes a lot of the things we have talked today. So Maria came back to me 2 months later. We sat down and I was so happy that she was smiling. She told me she just had 1 short flare since the last visit. She also implemented all the treatment plan we have done. Now she came back to me with a written flare plan, and she told me I'll always follow this flare plan if in case it reoccurred again. But the good news is, because of those lifestyle changes we made, we are expecting that she will not have any more flares. Now let me leave you with 3 important action items from our video today. Number 1, write your flare plan today. Ask your rheumatologist to help you create your flare plan. Number 2, protect your sleep. Sleep is so important to minimize your flares and also help you manage your flares. Number 3, focus on one NESSCAR pillar among those 7. Either it could be nutrition, exercise, or sleep, or any others, and be consistent with those. If this video helped you learn about flare and then having a flare plan, please like and subscribe and share this with other RA warriors who might be struggling with RA flares. Comment your first sign of a flare and which NESSCAR framework do you like the most. And also reminding you to grab your free RA starter kit that includes 3 important things to do and 3 things to avoid with your early diagnosis of rheumatoid arthritis, and a free copy of our book chapter. And all of you RA warriors, you are not alone in this rheumatoid arthritis journey. Together, we can move from pain to the possibilities. I'll see you in the next video. Take care. Bye-bye.